The prescription opioid epidemic continues to grow across the country. Every state, county, and city is being impacted. In 2015, overdose deaths surpassed both vehicular and gun deaths. Despite the media attention and the increased resourcing from government officials, first responders, especially emergency rooms, are being hit hardest. Valuable resources are being stretched thin due to a lack of treatment options. This is creating a revolving door at the emergency room as patients present, discharge, and readmit for opioid dependency and addiction. Hi, my name is John Campy. I'm the CEO of Bright Heart Health. Bright Heart Health is a telemedicine medication-assisted treatment program. We created Bright Heart Health to make treatment more convenient and accessible for those in need. By using technology, we're reducing the barriers related to accessing care by making treatment more convenient and available in rural and other areas where treatment may not be accessible. We have a new service, though, that we'd like to tell you about. It's taking our innovative approach even further by partnering with emergency rooms across the country to make opioid treatment available to those who present in the emergency department. This is a complete opioid treatment program, including medication-assisted treatment, as well as counseling. More importantly, when patients are in the emergency department, both emergency room staff and patients can book the appointment and complete the intake paperwork so that they know they have ongoing care when they discharge. We believe that this service is going to be very valuable to those emergency rooms that lack care in their immediate area. Let us tell you a little bit more about it.
Emergency departments are busy places. People come in for all types of illnesses, and the illness of addiction is often where the emergency department presents.
So to introduce myself, my name is Rev. Close. I'm an emergency physician practicing in Monterey, California. I am the lead clinical physician for our Monterey County Prescribed Safe initiative, and I have been learning about dealing with and treating the opiate epidemic for my 20 years in emergency medicine.
My name's Casey Grover. I'm also an emergency physician in Monterey, California. I also work on the Monterey County Prescribed Safe initiative. I see opiate addicted and withdrawing patients almost every shift I worked in the ER. In fact, I'm working later today. I'm assuming I will see someone in opiate withdrawal later today. This is what we're seeing every day when we go to work.
One of the major challenges is a lack of providers who can continue medication management for opioid treatment.
We're in kind of a tough spot in Monterey. We don't have a lot of access to treatment for opiate addiction. And so unfortunately in the emergency department, we're putting patches on major medical problems because that's the best we can do. Meaning that in an ideal world, we'd start the patient on treatment for their opiate dependence. We could refer them to definitive treatment for addiction. We can address the fact that they may have mental illness and addiction, the so-called dual diagnosis. And right now we're basically giving them a couple of medicines to help make their withdrawal better and giving them a couple of referrals in the form of a handout and saying good luck. And unfortunately, we're not really able to do as good of a job as we would like to really provide people treatment for what is a actual medical condition, namely opiate dependence. And certainly opiate withdrawal is very unpleasant. And we are certainly doing our best, though our resources are limited to treat it.
What we know about emergency departments is that if they do approach addiction treatment, no matter the addiction treatment, it's quite effective. It's quite effective in linking people to treatment. There are some places that are using buprenorphine. They're inducing buprenorphine in emergency departments, and what we see is treatment retention more than doubles based upon the Gale D'Onofrio study from 2015. Moreover, if you treat somebody for their opioid addiction in the emergency department, what we see is the rate of return decreased by 17% from year over year. So emergency departments are where people are going, and it's a wonderful opportunity to get people started on treatment. It decreases the recycling within emergency rooms, it decreases high utilization.
With our innovative service, we're taking a hub and spoke model, which means we can provide physician services in the vicinity of the emergency room, but then the follow-up care can be provided through telemedicine.
One of the great barriers that emergency departments face is disposition. Where are they going to send the patient after they've stabilized the acute crisis? And at Bright Heart Health, what we've done is we've created a program of direct access for emergency departments. through our web portal, a patient in the emergency department, whether it's with their own device or a portable computer or an iPad, can literally sign up for an appointment within 48 hours and get an appointment scheduled to see a physician to come into the program. One of the things that we know is that people's desire to get treatment varies over time. It's a measure of motivation. And oftentimes when they're in the emergency department, they're ready, they're suffering. They want to change the ways that they want to change something about their lives. And it's a great opportunity to get patients introduced to treatment and get them plugged into treatment as well. So we've set up a system that is easy to access. Patients can go on it, they can sign all of the consents, fill out all the necessary information, and before they leave the emergency department, they'll have an appointment that they know themselves, but also can be put into the discharge summary for the emergency department.
My patient comes in horrendously sick. I'm able to make them feel better, and I'm able to get them into treatment. I want treatment for my patients. As an ER doc, I have a one location, one place, one time to start helping these patients. I need someone to help me. I need the person to take the next step and actually get this patient in recovery, get their symptoms controlled, and get them feeling better so they can re-enter their life. I want somebody to give them their life back. They need someone to take care of them. That's what I want. I want what I have.
We believe that partnering with emergency departments is going to be a huge benefit in reducing the revolving door of treatment. By taking our innovative service of technology, a network of physicians and counselors will help alleviate the challenges faced when treating opioid use or opioid overdoses in your community. Reach out to us today. Thank you.